Have you ever wondered if you truly have celiac disease or just a wheat sensitivity? The distinction matters because understanding what exactly is going on in your body, getting a proper diagnosis, and mapping out a treatment plan is really important. So today I want to help you understand more about what is celiac disease, how is it diagnosed, and why is testing so important prior to doing an elimination diet. So celiac disease is an autoimmune condition where the trigger is gluten, and that leads to inflammation within the lining of the gut and destruction of the villi, the little projections within the lining of the gut that help absorb nutrients and so many other things. And this chronic destruction can have long-term complications. So it's really important to diagnose it because the treatment is lifelong avoidance of gluten. It's not a preference or a trend or a fad diet. If you have celiac disease, you must avoid gluten. If not, that chronic destruction of the intestinal lining can lead to nutrient malabsorption, anemia, osteoporosis, neurologic symptoms, and either other autoimmune conditions. Celiac disease tends to have some genetic predisposition. The HLA-DQ2 and HLA-DQ8 genes are often present in patients with celiac disease. That said, just because a patient has those genetic variants does not mean that they will develop celiac disease. Only perhaps 2 to 5% of those patients with positive genetics go on to develop celiac disease. So non-celiac gluten sensitivity is entirely different. This is non-autoimmune in nature, and we don't see the same intestinal damage like we do in celiac disease. But don't discredit this. The symptoms are real, and it can cause a lot of suffering. Non-celiac food sensitivities and wheat intolerance can produce gas, bloating, diarrhea, constipation, and sometimes even extraintestinal symptoms like skin rashes, brain fog, fatigue, joint pains, muscle pains, and headaches. But unlike celiac disease, these conditions are typically reversible when you have the right approach. As we mentioned in the previous video, reversing food sensitivities often requires a holistic approach, addressing the microbiome, intestinal inflammation, permeability, digestion, absorption, sleep, chronic stress, nutrition, hydration. All of these things are critical, and healing happens over time. It's typically a slow process, so working with a certified functional medicine practitioner who really understands and can be there to support you is ideal. So how is celiac disease diagnosed? Well, typically it starts with a blood test while someone is still eating gluten. There are a number of different tests that can be ordered, and each has a time and a place. The proper laboratory workup for celiac disease does get pretty tricky pretty quick, so don't assume that all practitioners are equal. So again, working with a qualified practitioner who really understands celiac disease and the proper workup is important so that you get accurate information and you don't waste time and money on unnecessary testing. Depending on the results, occasionally a small bowel biopsy is necessary to formally diagnose celiac disease. So if celiac disease is ruled out, then that opens the door to a much more flexible approach to treatment. For some people, gluten avoidance is just temporary while the lining of the gut heals, and then they can successfully reintroduce it down the road. The key is making these decisions based on clarity and accurate information, not fear or overly restricting. So in the next video, we're going to talk a little bit more about why some people feel terrible when they eat wheat, and it's not a sensitivity and it's not celiac disease. We're going to break down FODMAP intolerance and a framework to get you back on track. I'm Dr. Kate. Thanks for being here.